Let me start by asking you to turn your cell phones back on. I hate it when I hear that. Something wrong with that. 5.6 billion people using wireless today in the world. 5.6 billion connections. Now, put that in a healthcare context. That's more people using cell phones than toothbrushes. Sometime at the end of last year, that shipments of smartphones passed the shipments of computers for the first time. And we expect the installed base in 2012 of smartphones to be bigger than the installed base of PCs. So really computing has moved to mobile. And we're talking about things like 4 billion smartphones sold between now and 2015. And as we look towards the out years, roughly half of those are going to go into emerging markets where people haven't had connectivity, and now they will. They'll be connected to each other, they'll be connected to the networks, and we foresee that they'll be connected to their healthcare providers as well. So really exciting opportunities, and the benefit of monitoring wirelessly, about being able to bring back information, be able to do, instead of, take 2 pills and call me in the morning, to be able to really personalize care and be able to monitor at all time. In fact, all the senior team at Qualcomm right now is participating in a little experiment where we're all wearing sensors on our arms that are keeping track of our activity levels and sleep and various aspects. And so we're really trying to understand this ourselves. Is this something that people will do? But clearly, if you have a chronic disease and we can monitor, and the healthcare professional can monitor, that is a huge benefit. And so what we do believe is that this will happen, and it may not happen instantly. We've sort of been through technology adoption cycles. I would say that the healthcare industry is even harder than some of the other industries that we've been involved with. But that's for good reason, obviously. It's such a critical thing to manage people's health. But if you look at some of these statistics, 77% of Americans over 65 have 2 or more chronic conditions. Johns Hopkins says 160 million Americans will be monitored and treated remotely by 2020. 88% of physicians want patients to be able to track and monitor their health at home. But when you hear about research that's going on in universities where people are detecting biomarkers which will indicate that you're likely to have a heart attack in the next 24 hours, then people who have a predisposition may be more willing to think about things like that as well.